Hi, I'm going to run through a few helpful tips just about back pain, mostly lower back pain, to give you an understanding of particularly chiropractors' thinking when people come in with back pain and what are really good home exercises, stretches that you can do to help you, particularly now when we're in lockdown and you can't necessarily get in to see us chiropractors. When people first come in, the most important thing we start with is always a really thorough case history. That's going through key things like how the injury happened. A lot of the time we get back pain from not necessarily one injury or one episode. It's kind of a gradual thing. It was sort of hurting, then it got worse. And that's very common when it comes to lower back and neck pain as well. A lot of people just wake up in the morning and have the pain in the back. Often you can look back through the history and you will see through a bit of questioning some episodes, and I often call them like grumbles. So it's, you bent over, picked something up and it was twinged and it was a bit sore. It wasn't really bad enough, so you ignored it. It went away pretty quickly and just carried on. And that's a warning sign. Often what you'll get is that going on over potentially weeks, potentially months of these little twinges and tweaks are warning signs that the back's not maybe 100%. The other things that are really key from our history, and obviously a lot of it is, we've got to take the whole story, but things that we can often focus on are aggravating factors. So what makes it worse? Is it bending? Is it lifting? Is it certain activities? Is it after exercise? Is it during exercise? Is it first thing in the morning? Last thing in the evening? These can all point to, number one, what's aggravating it, but also number two, what structure in the back is getting aggravated. Particularly bending forwards. If you get pain when you do that, that thinking then goes more to the disc in the spine. So that's, people talk about slip disc or damage to the disc. Often that is made worse by bending forwards. The other thing is when you bend backwards, that's often one of the small joints in the back of the spine, the facet joints. Those often have problems when you bend backwards, but there are lots of different variations on that. Going through the history, we need to make clear about any medication you might be on. So we need to know what might contradict things that we will do. If people have underlying medical issues, high blood pressure, diabetes, cancers, we need to know all of these facts, and that's why we ask such a thorough case history of our patients. Moving on to a few general bits through the physical examination. The first and most important thing, and people think it's not that important because you're just looking, but actually visualizing the spine, looking at the overall posture, looking at it from the back, looking for any curves side to side, looking at your posture side on. Are you upright? Are you slouched? What makes the pain worse in which posture? That's really important. Often you can pick up lots of things. I've picked up loads of curves in the back or scoliosis just by looking at the spine. You can see one shoulder sits higher than the other, and then you look through, the pelvis is unlevel as well, and that's because there is a curve in the spine itself. The other thing is you can often, in really acute pain, you can often get people tilted off to one side. That again can be from a few different causes, but that will give you a thinking as to which test you then want to do to figure out what the cause is. You're narrowing down your suspicions each test that you do, essentially. So once we've observed and we've looked at posture, we've looked at, we then move on to range of movement. Again, it's a very generalized test, but it gives you a really good route to focus the examination. Pain when bending forwards often indicates disc pathology. Pain when bending backwards will often indicate facet joint strain or facet joint problems. There are other things that we can look at, so muscular involvement, ligamentous involvement. So we always do bending forwards, bending backwards, bending sideways on both sides, and twisting, rotating. And that will then give you another narrowing of the avenue towards the eventual diagnosis. Once we've done that, we can then look at more specific tests. So particularly I would do, if you were bending forwards and it was painful, I would generally focus more on potentially disc tests. If it was painful when bending backwards, I would start looking at more facet joint tests. So you deviate in whichever direction you feel the tests are taking you in. When we look at disc issues, the really simple exercises, and generally what I will give to a lot of patients, particularly when in acute pain, and this could be very helpful if you're watching this and really struggling, are extension exercises. So you get pain when you bend forwards, generally with a disc issue, but actually bending backwards will give you relief. Really good exercise to do here. It's a variation of a Mackenzie exercise. It's standing backwards bends. Stand up nice and straight. You put your fists on your lower back. What you're doing is you're pushing forwards with your hands and bending backwards over them. You want to go back to a point before it gets painful, before it gets really stiff and tight. It's all about repetition, little by little by little, doing those repetitions. You want to do 10 repetitions. I would always recommend to start, you do this morning and evening. You might find that actually when you're doing it, you don't get that much improvement in the movement, but it will get you moving quicker, particularly in the mornings. Once you've got comfortable doing it, you can do it all during the day. So I would say definitely in the morning, definitely in the evening, sets of 10, and then try and do it during the day as well if you can. It really does help, and it helps move things along. The other thing to mention is using ice. I always give patients who have acute inflammation advice on using ice. So that's frozen peas, ice pack, like the BioFreeze gels are the ones that we sell, but you can get deep freeze, various different brand names. They work really well, and doing that consistently. So with an ice pack, wrapping it in a t-shirt or a towel on your lower back, no more than 10 minutes, off for an hour, stick it back in the freezer, and then you can reapply to your lower back. I generally recommend doing that 2 or 3 times a day if you can do. Similar principle with the gels, rub them on once every hour or so, follow the instructions of that particular gel. It's doing it regularly and consistently. The final thing that's always really important and often overlooked is moving as much as you can, particularly when you have acute lower back pain. Keeping up a mobile will stop your back stiffening up. It will, in the long term, help reduce pain levels as well, and will get you back to activity quicker. Try and avoid sitting on the sofa for long periods, lying in bed for long periods. Yeah, it feels comfortable at the time. As soon as you try to get up and move, it will be really stiff and it will be really sore. Those are some straightforward tips to do when you have back problems. Also a bit of our thinking when you do come into the chiropractor to kind of give you an idea of our thought process and how we try and narrow down the problem that you come in with. But that does give you a general idea of our thinking and hopefully a few tips as to how to help it.